Welcome, I'm Catherine Hadro, and this is EWTN Pro-Life Weekly. The state of pregnancy care centers, we get the pulse on the pro-life movement amidst dual national crises. Assisted suicides over Zoom, a Christian bioethics expert sounds the alarm. And Safe Haven, Arkansas saves its first baby with the Safe Haven boxes. This week, we're taking a look at how dual national crises are impacting the front lines of the pro-life movement right now, pregnant women and the work of pregnancy care centers. During this historic time, while states are beginning to reopen from the coronavirus pandemic and nationwide protests grow in number in response to George Floyd's death, pregnancy care centers are continuing to serve pregnant women in need. This as the abortion lobby is forcefully pushing for an expansion of chemical abortions with fewer restrictions. But what impact is all of this having on women? And should we expect an uptick in abortions as a result from these two major national crises? To help us check the pulse on the pro-life movement during this historic time, we are joined via Skype by Jor-El Godsey, the president of Heartbeat International. Heartbeat International is the largest worldwide network of pregnancy help organizations. Jor-El, welcome to the show. What are you and your network of pregnancy centers hearing from women right now? And are you anticipating there will be an uptick in abortions?
Well, the answer to that is definitely yes. We know that the abortion industry is seeing this as an opportunity to increase their outreach. They stayed open even as other so-called essential surgeries and procedures were denied, and abortions are increasing. And certainly if it's a crisis pregnancy in the midst of normal times, it's probably even more so in the hearts and minds of women who are facing an unintended, unexpected pregnancy. And so abortion becomes more of an allure to them. So we've been able to serve them and impact them. The centers have stayed open, Catherine. That's what's been beautiful. Even as stay-at-home orders have been issued, they might not have stayed open, like be able to walk in like you would have normally done, but they've still continued to serve. And that's what's been amazing about the pregnancy help movement across the U.S. is still adapting, being flexible, impacting their community with life-saving services.
What have your centers been hearing regarding abortion pill reversal?
Well, this has been an ongoing thing. It's been something as you've highlighted in the past. It's been ramping up. It's now we know that the estimates, even in 2020, are that they're going to be about 50% of all abortions in the U.S. will be chemical abortions. And we're actually seeing that play out in our abortion pill reversal process. We have an abortion pill rescue network where we have nurses that will answer calls in for those that have taken that first pill and are now immediately regretting it. And there's a window of time where we can introduce the abortion pill reversal protocol. We can connect them with a life-affirming pro-life doctor that will help them accomplish that wherever they are in the country. We're doing our level best to make it happen, and we've seen those numbers go up. So even in the last 3 months, while many things have been shut down and moving in another direction, our calls at Option Line have been 30% higher than normal, and our calls at the Abortion Pill Rescue Network have actually been at record levels for us.
Well, that is so telling. Jor-El, the topic of race is at the forefront of our national conversation right now. How is Heartbeat International dedicating resources specifically to minority communities?
Well, this has been one of those adventures that the pregnancy help movement has been on for a long time because the minority communities have been targeted by folks like Planned Parenthood. Just look at where they locate their service centers. They do so in the middle of urban areas. They seem to target minority groups, and we know that the statistics tell us that the minorities have been disproportionately higher abortion victims over the last several decades. So our outreach hasn't changed so much in the last few weeks because it's been ongoing for decades. But one of the interesting things that people might be interested in knowing about is Heartbeat's a life launch program where we're helping centers get open, new pregnancy center organizations get open, and some of those are in urban areas, some of those are in underserved, all of them are in underserved areas, but some of them are in rural areas, different places. We need more life-affirming help going out, and it's been great to be a part of the life launch effort to help centers make that happen.
Absolutely. Jor-El, can you speak to what the health and safety precautions pregnancy care centers have taken amidst the coronavirus pandemic?
Sure. Those that have been able to continue serving in person have adopted of course, the PPE, the personal protection equipment, have instituted protocols for social distancing. That they're either maybe allowing fewer people, limiting in the waiting room, just like when you encounter your doctor's office, you have to wait outside. There's been varying things depending upon each state's adaptability to this environment. But whatever they can do to still continuing providing that life-affirming help, that relational impact. A lot of services have moved online where we had parenting classes and follow-up consultations. Those have been able to move online. I mean, how many of us are now new Zoom experts where we were not before? Well, that's exactly what's happening in our pregnancy center communities. And they're even engaging people in different and dynamic ways so that services can continue. We actually have several centers that have been doing home deliveries of material items and whatnot. So it's an awesome thing to see, like the adaptability of really this life-saving impact.
Finally, can you just share a word about the importance of offering women hope and resources amidst a culture of fear and panic right now?
Well, hope is the number one thing that we should all have. And of course, fear and panic wants to steal that hope from all of us. And look, an unexpected, unintended pregnancy is difficult. It's an issue of fear and panic, and even the normal times, and even more so in the midst of dual national issues like we're facing. But it all comes down to loving, compassionate, non-judgmental help, and that's what really will overcome fear. Things like the love approach, and whether it's localized to that person or it's in the midst of something that we're all experiencing globally, it is the one thing that we should always traffic in. So we're grateful that at Option Line, Abortion Pill Rescue Network, that we can connect people to life-affirming help across the country and even outside the country.
Jor-El Godsey, president of Heartbeat International, thank you.
Thank you, Catherine.
We continue our conversation now with Tessa Longbons. She is a research associate for the Charlotte Lozier Institute and joins us via Skype. Tessa, welcome to the show. Tell us, what does your research indicate about abortion during this unprecedented time?
Well, thanks so much for having me, Catherine. So we won't have the official numbers until states start to release their 2020 abortion statistics, but we have unfortunately heard reports that abortion rates are going up in some states during the coronavirus pandemic. Tragically, a lot of women, when they find out they're pregnant during the pandemic, are scared because they could be out of work, they could be nervous about being pregnant and giving birth during a pandemic. And so we've heard reports that some abortion centers are very busy. But we've also heard reports from other states that abortions have actually gone down because due to travel restrictions, abortion providers haven't been able to fly in from out of state to do abortions. So it's really varied from state to state. And it's something we're going to be watching for as states begin to release reports.
Tessa, abortion activists are pushing right now for chemical abortions with fewer restrictions. Do we know yet if more women are undergoing chemical abortions this year?
Yes, so abortion activists have taken advantage of the coronavirus to sue to remove Food and Drug Administration safety protections on the abortion pill during the pandemic. This would allow the abortion pill to be distributed by mail or through a pharmacy. And so we don't know exactly how many chemical abortions have been happening so far this year, but we do know that chemical abortions have been going up. They make up about 40% of all abortions now, and some abortion centers have said that they are seeing more women for chemical abortions. So definitely something that we are concerned about and watching for as the situation continues.
Do you think the rise in telemedicine will impact the abortion debate moving forward?
I think it has already begun to impact the abortion debate. This has been something that's been a priority of the abortion industry, trying to expand chemical abortion through telemedicine. Even before the pandemic, there was an ongoing trial to distribute the abortion pill by mail to women in some states. And of course, as pro-lifers, we're very concerned about this because this is obviously dangerous for unborn babies, but for their mothers as well. And it's something that we're paying more attention to and is definitely becoming more and more of an issue as we see just what damage the abortion pill can do.
Finally, the current economic uncertainty can add to the stress of facing an unplanned pregnancy. Can you quickly speak to how pregnancy care centers do offer women hope at this time?
Well, offering hope is what pregnancy care centers do best, and it's been very inspiring to see how they've been able to continue coming alongside women and children and their families and serving them during the pandemic. We've seen pregnancy care centers work to educate themselves on the risk the coronavirus poses to pregnant women so that they can reassure women and let them know that they generally don't face any heightened risks and that they can be confident about continuing a pregnancy. We have seen pregnancy care centers work to connect women who may have panicked and taken the abortion pill with abortion pill reversal, and just go alongside with them through that process and encourage and support them. And we've also really seen pregnancy care centers be very creative and think outside the box about how best to support women during the pandemic. Pregnancy care centers have created online baby registries, and pro-life groups have worked to connect people and churches with pregnancy centers in their area so that they can purchase items from the registry and get those items to the women and families who need them. So it's been very inspiring to see how pregnancy care centers have stepped up.
Absolutely. Tessa Longbons with the Charlotte Lozier Institute, thank you.
Thank you, Catherine. Thanks so much for having me.
Russ Vought has been nominated by President Donald Trump to serve as director of the Office of Management and Budget. Here's what we know about Vought. During his time as acting director of the office, he's worked to ensure pro-life protections, including exposing the hidden abortion surcharge within Obamacare and stripping Planned Parenthood's Title X funds. Acting Administrator Vought has proven in this time he values the life of each and every unborn child. That is why we want to encourage the U.S. Senate to swiftly confirm him so he can continue to protect life in this crucial position within the administration. And that brings us to this week's call to action. Go to prolifeweekly.com to urge your senators to confirm Russ Vought as director of the Office of Management and Budget. Here's all you have to do. At our website, you'll fill in some basic information so we can tailor a letter to your specific senators. You will absolutely be able to change any wording you'd like, but we have made it easy for you. Let's get those letters to our senators in so Russ Vought can be confirmed and advance more pro-life policy goals. Just go to prolifeweekly.com. In the wake of all things digital and remote right now, a Christian bioethics expert and lawyer is sounding the alarm that the push for Zoom and Skype calls now also includes calls for assisted suicide. Bioethics expert Wesley Smith wrote an online post for the National Review last week titled, "Doctors Now Assist Suicides Via Zoom." He pointed out how a Washington state physician who administers assisted suicide admitted to the publication The Conversation that she's seeing 90% of her patients online right now and says she does not feel badly at all that she does not hold a stethoscope on their chests. Smith writes, quote, "It is amazing to me how legalizing assisted suicide transforms people's thinking. Making people dead quickly becomes the overriding imperative, and suicide prevention for the seriously ill goes into total eclipse. The easier it is to get people dead, the better." And joining us now via Skype is Wesley Smith. He is the chair and senior fellow at the Discovery Institute's Center of Human Exceptionalism. Wesley, welcome back. Okay, put this into perspective for us. How exactly is Zoom and Skype being used right now when it comes to assisted suicide?
Well, in these assisted suicide laws, you're supposed to physically examine patients. An initial doctor is supposed to do it, then refer to a second opinion. Well, as these advocates promised, it was going to be the person's own physician after a long-term relationship and so forth. Well, come the COVID crisis, and actually even before, some doctors are saying, well, why should I even have to meet personally with the patient? Let's just do it over the internet. And so now what you have is the initial interview with the patient, the supposed examination, being done as we are doing this interview, meaning not in person, no real depth. And then the second opinion is actually sometimes done by phone. So what they've done is they've used the internet to shortcut and cut corners on what was supposed to be strict guidelines to protect against abuse. Well, the strict guidelines don't protect against anything and very quickly come to be seen as obstacles to people being made dead.
Wow. You know, Wesley, there are reports that prescriptions for antidepressants and anxiety medications are surging right now. That's really not surprising, considering the isolation, unemployment, and national tensions. But can you speak to why that makes it even more troubling that assisted suicides are ongoing right now?
Well, assisted suicide advocacy says that some suicides are good. And so what you have happening are states actually giving their formal imprimatur of sanction for people to kill themselves. And then when people who have an illness and want assisted suicide, they're not given suicide prevention. So if you're not in that cadre, you look at this and you see people with respect and the law saying that some suicides are good, you begin to think to yourself, well, maybe it's okay for me too. In Oregon, for example, there has been only one study that I'm aware of that has tried to look into this, and it did find some association with advocacy and the increase in suicide generally. Frankly, I think this is an issue that suicide investigators should look at. What impact does assisted suicide advocacy and does assisted suicide legalization have on the view overall of suicides outside of the illness or disability context? I'm just afraid they're not doing the studies because they know what they don't want to know.
Wow, that is terrifying, especially right now when we should be offering hope and not sending this message that you're better off dead.
It's an abandonment.
You know, right, absolutely. Wesley, what does this reveal to us about the true intentions of the assisted suicide lobby?
Well, the assisted suicide lobby is engaged in a great pretense. The pretense is that this is going to be a very limited, tiny, itsy-bitsy change in normal medical procedures, that it will only be done as a last resort when nothing else can be done to relieve suffering, and only when it is in the context of your own physician who's known you for years and years and you have a loving family and so forth. That's all just baloney. What it really is about is softening people up to the idea that suicide and eventually lethal injections are an acceptable answer to human suffering. And as we've seen in places such as Canada, Belgium, the Netherlands, once you accept the idea that killing is an acceptable answer to human suffering, it very quickly expands. It has been generally restricted in this country because we're putting up such a fight to prevent it from being legalized. But once a society generally accepts these premises, pretty soon you have mentally ill people being euthanized, as in the Netherlands, and their organs harvested because they're not sick, so their organs are really good for transplantation. This is the kind of ugliness that assisted suicide unleashes.
Well, I'm just so grateful that you are keeping your eye on this issue and that we can turn to you to help us navigate this. This is unbelievable. Wesley J. Smith with the Discovery Institute, thank you.
Thank you, Catherine.
Coming up, Arkansas saves its first baby with its Safe Haven box. We'll tell you more about this innovative and life-saving initiative. Welcome back to EWTN Pro-Life Weekly. I'm Catherine Hadro. A TV host and personality raised money for Planned Parenthood on the ABC game show Who Wants to Be a Millionaire? That is this week's Speak Out segment. Bravo television host Andy Cohen competed on the popular game show to raise funds not for himself, but for Planned Parenthood, the nation's largest abortion provider.
Final answer, D, Jimmy Kimmel. Yes, Jimmy Kimmel.
Cohen competed on the game show alongside CNN anchor Anderson Cooper, who raised funds for the Spikes K-9 Fund. It's ironic that funds were raised for Planned Parenthood on a show called Who Wants to Be a Millionaire, because Planned Parenthood is a billion-dollar organization. On top of that, Planned Parenthood receives over $500 million in federal funding every year. So this celebrity game show is small chump change for the nation's largest abortion business, but it remains unfortunate that the TV star used his winnings for this giant corporation instead of a more worthy charity during this time. newborn baby was legally surrendered and saved in a safe haven baby box for the first time in Arkansas last month. The infant was surrendered at a fire station in Benton, Arkansas, inside a baby safe haven box that was installed last September. Arkansas's safe haven law allows a parent to bring a child fewer than 30 days old to an employee at any hospital emergency room, manned fire station, or law enforcement agency without facing prosecution for endangering or abandoning a child. The law also permits use of a safety device such as a baby safe haven box so the parent can remain both anonymous and keep the child safe. Babies who are surrendered are placed for adoption by the state's Department of Health. Monica Kelsey is the founder and CEO of Safe Haven Baby Boxes. She joins us now via Skype. Monica, what can you tell us about this newborn who was recently saved in Arkansas?
This newborn was the first newborn ever to be received in a safe haven baby box in the state of Arkansas. It actually made history when this happened because this had never been done before. The box in Benton, Arkansas is the only box that we have currently in Arkansas. We're working tirelessly to make sure that no baby is ever found dead or abandoned illegally again in this state. So we are looking for more locations to install our boxes in Arkansas.
Tell us about why you founded Safe Haven Baby Boxes in the first place.
Well, you'd have to go back 47 years to August of 1972 when a young 17-year-old girl was brutally attacked and raped and left along the side of the road. And this was when abortion was illegal in our country. This young 17-year-old girl pressed charges against the man who had raped her. He was arrested and he was charged. And then if that wasn't the worst of it, she finds out she's pregnant. And she was hidden for the remainder of the pregnancy. She gave birth in April of 1973 and abandoned her child 2 hours after that child was born. And that child was me. So my biological father is a convicted rapist, and I don't even know my ethnicity, but I'm still a human being and I still have value. And I want to make sure that every mother in this country knows that there is a safe option for her newborn so that she can safely surrender without prosecution, and this child will be saved.
That is so powerful, and thank you for sharing that witness with us. Monica, for our viewers, can you just explain how exactly these boxes work?
Absolutely. We actually cut a hole in the side of the wall of the building like a fire station, kind of like you're putting a window in, and the box slides into the fire station. These boxes are heated, they're cooled, and they alarm 911 as soon as the door is open. So immediately upon the mother placing the child inside this bassinet, it's a medical bassinet, 911's already getting a call. Babies retrieved from the inside of the fire station, and the average time for our babies in our boxes are right about 2 minutes. So it's very quick for these babies to be retrieved. But the most important part is these women get the anonymity that they've been asking for years. And that's why they're working, is because women want anonymity, and these boxes are the only way to get it.
What do you want people to know about safe haven laws?
The safe haven law is there to protect a mother who doesn't want or can't care for her newborn child. I want these women to understand that there is no shame with surrendering under the safe haven law. There's no blame, there's no names. And if a woman finds herself in that situation, that she can call us on our 800 number. It's 24 hours a day, 7 days a week. It's nationwide. We can assist with a parenting plan, an adoption plan, and as a last resort option, surrendering under the safe haven law.
Wow. Monica, how many baby boxes are there in the United States?
Currently, we have 27 active baby boxes across 5 different states. And we have in the works probably another 25 to 35 more that we're working with. We're also working with states to get these boxes in every state. I think that if we don't do this, we're going to continue to find babies laying at the doorsteps of fire stations and hospitals in unsafe places where if a box was available, they could place their child in a box and the alarms would go off and these babies would be retrieved immediately. So we are working very hard to make sure that this happens nationwide.
Wow. Well, again, thank you for your witness and for all of this information. Monica Kelsey, founder and CEO of Safe Haven Baby Boxes. Thank you.
Thank you.
That does it for this edition of EWTN Pro-Life Weekly, coming to you from the Hadro home. Before we leave, I want to acknowledge the ongoing national news coverage we're seeing surrounding George Floyd's death. Please know we've talked on this show about how racism is a life issue, and that's not a one-time discussion. It's a topic our team is continuing to pray about and plan for how we incorporate it into conversations we have right here. The pro-life movement reflects that every human life has dignity and is worth protecting, whether that's a baby in the womb or a man on the street. And until next week, we'd love to hear from you. Find us on social media at EWTN Pro-Life on all social media platforms, and you can always send us an email at prolifeweekly@ewtn.com. Remember, life is a gift. Your life is a gift. God bless.